It's week 25. We've actually made it. I forget what it's called. Is this the silver anniversary or something like that for 25? Let us know if I'm right or wrong. So last week we talked about we wanted more encouragement from our listeners and people watching our show regarding the immune system. Um, Obviously everybody's hearing these words. What can we do? What immune suppression? What are we doing to help? We were hoping for a little bit more reactions. I don't know if people are just afraid to communicate with us. Communicate with us, and we'd love to hear from you. We'd love to hear the funnies. We actually have it's the week of Halloween, so we're gonna get into Halloween. That was Nicole doing her best mask invitation. Um, but bottom line is, we're looking to do alternatives. I don't want to push it. We're going to talk about it today. What else can we do? I pride that Michigan Sports and Spine is all based on injury recovery and prevention and being proactive, not reactive. And that's just the way it is. I mean, I've talked to a lot of younger people talking about infrastructure. We'll talk about one patient I had this week where he's very well built, but he created a muscle imbalance. So how to train a certain way that you don't put your body at a disadvantage where it's prone to injuries. When I was working with the Red Wings back in the day, when we all heard about these sports hernias, that was really because part of it was because of the muscle imbalances that were being created. And it kind of trickled all the way down to all through the hockey world. And you really don't hear about sports hernias like we used to. One, we treat it a lot better, not to go off on sports hernias, but there's more surgeons that are doing the procedure. We're doing a better job of training to prevent it. So that's, kind of the theme of what we're trying to talk about, especially with COVID, immune supportive. We're talking about what's supportive. We're talking about, again, proper nutrition is huge, proper sleep-wake cycles. Obviously wearing the mask and washing your hands and being 6 feet is definitely helpful, but it's definitely not the only answer. And the thing is, they're talking about upticks of cases, but they're cases where the labs are showing up as positive. But we're not seeing an uptick right now that I'm aware of in the hospitals and people on ventilators and things like that. So that's good news. We are getting through it. We're getting into the flu season, which, again, I think if we use all these universal precautions and actually are more aware of our own health, we're going to see a decrease in all the flu symptoms, including COVID. So that is the overall goal, and that is the overall message. So we'll get into that, but right now, getting into the questions. We were busy last week talking about COVID and immune suppression, and me probably goofing around. But I guess one question I cut short. It said last week you touched on this, but I'd love further explanation. For almost 2 months, my right knee has started locking up when walking. This is serious. Can you go into detail about why the locking of the knee is of concern? Thank you. So again, the knee itself, we can pull one of my little models here. So this is the knee, okay? So we can look at the knee. This is the outside, this is the inside, this is where the kneecap is, and then these are the ligaments inside the knee. So you're going to see in here, this cushy part is the meniscus. Okay, with this meniscus, that's kind of where the locking comes. When you go inside, there's a crisscross of ligaments called the ACL, the anterior cruciate ligament, and the posterior cruciate ligament. Anterior meaning it's going forward, posterior means it's going back. So those are the big ligaments up inside there. But the cushion part, when we talk about my cushion's worn out or it's bone on bone, this is what they're talking about. It's this area in here. When there's locking, it's usually something going on with the ligament. Assuming you're not stage 4, which is the worst stage of the knee issue, where it becomes bone on bone, that's another issue. Early on with the meniscus, if the meniscus is partly torn, what will happen, it'll kind of flip open on itself. That's the worst thing. We'll call that a bucket handle tear. So the bucket handle tear will cause that locking sensation. Sometimes you get locking because the knee itself lines up like this. Sometimes you actually get a little movement because of the instability of the knee, and you get into a weird position where it won't move into that groove. And sometimes you kind of, you hear people, I flick my knee a little bit, and then all of a sudden I can move it again. You're actually moving it, and these are millimeters of movement, not big inches or anything like that. It's small little movements that move it back into that groove so you can start moving. So until I really get my hands on you, I can't tell you exactly why you're locking. But those are the two most common things. One, again, that the meniscus, the cushion part of the knee, has a small partial tear in it. Not really the ligaments on the side. That could be causing it also, but less likely. And then if there's instability of the knee itself, it comes out of its natural groove, which will create a locking, or I can't bend it as much, or I can't extend it as much. But all that stuff is saying that there's something wrong with your knee. When I ask, is it serious? I never overreact. It's not that I downplay things, but I'm not the doctor like, oh my God, if you didn't see me this week, you might have died next week. That's not who we are. We play it down because everything has a solution. It's not like, oh my God, it's not an oh my God feeling here. We're very calm. We're very direct. We've seen so many things. So when we say, is it serious? There's nothing that serious. We can usually resolve it. Usually there's a plan we can put forth, especially with the knee, because there is a lot of treatment options. So is it serious? No, it's not serious. It's just something that needs to be, diagnosed properly and a treatment program for it. It's just a routine thing that, there's different degrees, like there's 1, 2, 3, and 4. So you're probably sitting in that 2, 3 range, meaning 4 is worse than 1, just for the record. So question 2, when's a good time to start decreasing my pain medications? I'm taking 4 Norcos a day, but wondering if it's necessary. So when is a good time? At Michigan Sports and Spine, the philosophy is the good time is starting the first day we meet you. We're always looking for alternatives. We never feel medication is the sole answer to any treatment program. We use it. We're not ones not to use it, but we use it appropriately in a junction with a true treatment program. Sorry. So what I'm saying is that we always look for alternatives, more natural alternatives, more of what you can do. Are we using electrical stim? Are we using ultrasound? Are we using therapy? Are we using the home exercises? There's all these other things. The newest thing right now is CBD oil. I had a friend text me today because I hurt myself. My hip and back is killing me to the point that I'm hoping to be able to sit through this whole event. But she's like, oh, you got to try CBD oil. And, there's many alternatives to narcotics. So to answer when is it? Today. Today's the day. You can always do less. The problem is, and I've said it multiple times, anybody who's listening, is that when we give you pain medication, it actually enables you and allows you to take the meds instead of do what's right. So sometimes going through that little bit of discomfort is forcing you to do more. Believe me, I'm the last guy to take any medication, so I will not take it. So what have I been doing the last 3 nights? I'm waking up in the middle of the night. I'm doing my electrical stim that Faith gave us, the wonderful therapist here, and icing. I'm getting up, I'm icing. I ice for 20 to 30 minutes. I'm doing compression. I'm doing certain stretching techniques to get my hip back in place, my back back in place. Am I waking up easier? Yeah, but it still woke me up in the middle of the night. So I'm not taking any pain meds. I'm putting up with the pain. I'm not hiding the pain. And I'm dealing with what mechanically needs to be done. So I'm living proof that, if you listen to myself, sometimes it does work. So am I getting better for those concerned about me? Yes. Thank you for considering that.
More enthusiasm.
Huh?
Page is on there.
Paige says what? More enthusiasm? All right, fine. I can get a little bit louder and excited. But the bottom line is, my daughter is actually back in Colorado. If you can see, she's messaging that I need to get a little bit more upright and more excited. But she was there the first night that it happened, and she was so sweet. She was like all worried about me because I couldn't find a comfortable position. I was like almost crying. So the point is, absolutely day one, you want to be off the medications, because what that does, it enables you to do something else, take the meds instead of do something that treats you. Okay, so you want to do the therapy, you want to do the stretches, you want to do the ice, you want to do the stim. There's a lot of alternative things. For those out there, the CBD oil, sure. Narcotics are necessary. It's not like everybody who's on narcotics is doing something bad. We use narcotics to get you over the hump. It's not there to treat you. Do I have patients that have been on long-term narcotics? Absolutely, because it's better than the alternative. We're here keeping people out of the emergency room, keeping them out of going to 5 other doctors. We create a plan for them where 4 is our limit. We won't give over 4. If we're doing that, then we're thinking about injections, we're thinking about surgery, things that will fix the problem, not necessarily mask the problem. So again, when is a good time? Today is a good time. It's just like everything we're saying. There's no reason to wait for tomorrow. If you need to see the right doctor, you need to see the right therapist that will push you in the right direction. There's too many. I don't know if I'm just going through a series of patients right now, but there's too many patients that are telling me, oh, my doctor just said take these pills and you'll be better. Well, that's, when you add another 10 years to that, that's a lot, a lot of, I can't say it. A lot of ways of that be a mistreatment. It wouldn't be what's going on here. We're not looking for that. Do we have patients that are looking for that type of treatment? Yeah. Do they stay here long? Most likely no, because we won't play that game. And it's a tough love thing that people that stick with us are very thankful and very easy to write testimonials for us and all that. So hopefully that answers your question. Overall, medications, narcos, opioids, any narcotics, start reducing today. Look at Tylenol, look at ice, look at electrical stim, look at therapists, look at a loved one to do a massage. All those things help. All right. So number 3, what treatment methods do you offer for carpal tunnel, specifically forearm pain and numbness? So really, forearm pain and numbness is not carpal tunnel, just so we're clear. Carpal tunnel is clearly from the wrist down to the fingers. That's true carpal tunnel. If you're starting to get dying back, what we call where it's going up the forearm like this, then that's a little bit more serious and it may be more involved. That maybe we have to look at what's going on from the elbow down or even the shoulder or neck down if you're having pain into the forearm. Or you really have a bad carpal tunnel. So what do? One, we evaluate to tell you right there, do you have the right diagnosis? Because carpal tunnel gets thrown around a lot. And there's a specific diagnosis and treatment and workup for it. There's something called the nerve test and EMG test, where we look at the conductions. It's very simple to quantify if you're having carpal tunnel symptoms and objective findings, meaning what's going on in your body objectively, that is hindering that nerve or blocking that nerve. So it's very specific diagnosis for carpal tunnel. So number 1, you need a proper diagnosis. 2, we talk about therapy. We talk about home stretches. We talk about changing your environment. We talk about the ergonomics of people being at the computers 8 to 10 hours a day at home, usually not in the best setup because they're at their couch, they're at their dining room table. It's very rare you have a nice setup like you did at work where we have ergonomic tables where they go up and down. So all that stuff is being missed and people are having more symptoms. They're happy to be at home working, but also the environment, the work environment may not be ideal. So you need to make sure that environment is good. What can we do? We do injections for that. We're doing PRP injections for it. There's talk about stem cells for it. So there's a lot of different things going on. And then eventually surgery if it's necessary. We have a team of surgeons that we work with that are very comfortable with minimally invasive procedures for the most of them. So yes, we're very comfortable with carpal tunnel. We would do the nerve test, we would set up the therapy program, and hopefully that would resolve it there. If it needs to go further, then we do have surgeons that we work with if the injections don't help. So question 4. I've been battling with low back pain for over 5 years now. Recently, it's become worse. My doctor said I should get an x-ray, but I've watched your show and I'm wondering if I should be getting an MRI instead. Please advise. So great question. And you know what? That's what comes in here. Probably 60% of the patients coming in are similar to this. It's ongoing back pain that gradually gets worse. It's not always one episode that puts you out. You didn't get tackled on the football field on Sunday and it blew your back out, those kind of things. It's a gradual decrease, and then you do something silly. You help your buddy move, or you got a little too crazy on a weekend bender, whatever it is. But that will play off and have a bigger problem. So an X-ray versus an MRI. X-ray is always good. I'll always order an X-ray to clear. But if you have symptoms or clinical findings that are saying that there's a pinched nerve, an irritated nerve, an affected joint, we definitely go to the MRI quicker. But we're the specialists. Usually the primary care will start, if it is your primary care doctor who's making this reference, then you should start with the x-rays and treatment, not just x-rays and do nothing. You have to start a treatment program. You should have started a treatment program. You should be on an aggressive treatment program if this is going on for 5 years. And if you've had back pain for 5 years, I'm kind of surprised you haven't had an x-ray or an MRI. Unless it's just that nagging but doesn't hold you up or stop you from doing anything, then that's fine. But right now, 5 years of back pain is a red flag for us. Continued symptoms that don't go away. Are you taking medication? Are you doing exercise? Are you being restricted? Or, have you had weight gain? How's your mechanics? There's a whole bunch of things that we go into to evaluate it. So if it's been going on for 5 years, I'd highly recommend you see a specialist like us sooner than later, because every day that you're not getting treated, you need 3 to 5 more days to rehab that. So if it becomes, a bigger issue, which it is, sometimes we talk about the last straw that breaks the camel's back, you are flirting with probably a bigger problem that you want to be more proactive before it blows up and has full leg pain or weakness or atrophy where you lose muscle. So you need to be active in that role. So again, we are very big in treating that. That's our sweet spot. And like I said, we'll do everything, short of surgery. And then if we need surgery for stuff like that, we have a team of docs we work with that we're very confident in treating. So real quick, not real quick. You heard that my daughter's out in Colorado. I don't know if everybody heard, but 12 inches of snow fell in a matter of 24 hours, and it's already melted. So with the weather here, it's been great. Everybody's being very active. I love, my biggest thing I say to my kids are, I want to cheat the winter. Meaning if it's nice out like it is today, like I'm trying to get out of here quick so I can get on my bike. When I can get on my bike and later in the year, I feel like I'm cheating, that I'm getting the cherry on the sundae type of attitude. And that's the attitude I'd like, all of you to take. I think a lot of you do. Michigan gets criticized big time if it's deserved or not. I know parts of it is definitely deserved, that we're lazy. We're not as active, especially when I talk about my daughter being in Colorado. They're so active. They're so health conscious. It's just such a dramatic change. It's refreshing for me. When I trained in Seattle, Washington is similar, where everybody's active year round. These people are, they're gearing up no matter what the weather situation is. And that's the attitude that people that want to be successful need to start taking. Don't use the excuse that the weather changes or, it's winter, I'm going to gain 10 to 15 pounds, and then in the summer I'll work it off. That up and down is not good. Not working your muscle structures is not good. You always need to be working your muscles. The best way to do things is maintain that muscle tone throughout, the up and down. I know somebody in my office that's guilty of it too, that lived on her youth for a while, but now she's working out all the time, which is way better. She's giving me a dirty look, but she knows I'm right. But that's the thing. It's like for the young people too. When you're living in your 20s and you're active from high school sports, especially if you played a sport. I have a few friends that are that way. They played soccer in high school. They had this great infrastructure of their muscle tone in their legs. And then, all of a sudden you've got a family, you got issues, and 10 years went by and you haven't been exercising. You still think, well, I used to play and I used to be in great shape. When you find yourself looking in the mirror and say, I used to, which I'm guilty of too, you're not doing yourself any service at all. You're not helping. You're not making an excuse. We live under that realm that you are what you do. Meaning the healthier you are, the better you are. You're just gonna be healthier overall, especially with the COVID. I was thinking of a story that I work out, and there's someone in the Live Nation, which is the entertainment world that I work with, and he doesn't work out at all, and he prides himself because. The rest of us are working out. So we're getting to that age. We've all known each other for 20 years now. And we're getting to that age, like if we play hockey, there's guys that play hockey who come home injured. There's guys that go play softball and we're blowing hamstrings out. And he's sitting there, well, I'm not doing any of it. I'm just fine. So who's right? The answer is, my answer is stay active. We'll be able to fix what's going on. To work with a body that's not functioning, it's not muscle tone, you're going to run into injuries. Like right now, again, with the COVID, the quarantine, the decrease of activity, you're losing that infrastructure of each joint. Like with my hip right now, I feel that's what's going on because I haven't been able to do my normal routine. I'm just biking, which is moving in a parallel position. It's not moving all the laterals. So I moved in a lateral position. I think, that's how I hurt my hip. When I work out, I do a lot more activities to keep that core strength around my hip. So that's one example. And then same thing for your shoulders. If your shoulder is weakened, okay, we've talked about this before, it's the ball and socket and it's the four big muscles. Well, if those four big muscles are weak because you're not doing your routine exercises, there's two little ligaments that aren't strong enough to hold it on their own. And then that creates that's a millimeter micro tear, anything, any instability. Now you're creating weakness, and now you're creating a long-term problem. So from the COVID, not just from having COVID, because now our academy, the Academy of Physical Medicine Rehabilitation, are coming out with guidelines for COVID illnesses and what we're seeing long-term, that we're actually working on doing more clinical studies of what we're seeing long-term from a heart disease, from lung disease, all that. But also I'm working from a sports medicine, musculoskeletal standpoint, is that you've lost all that infrastructure. Shutting down these gyms, shutting down all these workout places, people are lost. They're sitting on couches. There's only, I would guess, maybe 10 to 15% that maintain the level of activities that they had before. So that's going to be a big problem with injuries over the next 12 months as we try to get back to our norm or our new norm. So, be careful of that. If you're one of those people, be proactive, get back to your activities. If you love it, you're still going to love it, and you get your adrenaline push from it, it's still there. Don't fall into the couch wasted potato chip eating type of person. And, I did it for like a week. But so question 5, which is great leading into my potato chip question. Does your nutritionist have recommendations for healthy alternatives for Halloween? What about for the kids doing school at home? I'm a mom of two kids under 12. Well, God bless you. I'm sure you want to pull your hair out some days. And giving them the sugar of Halloween, I see where you're going with this. Alternatives. The alternatives haven't changed over the years. Even when I was a kid and you were a kid, trick-or-treating, we always got that one person who gave us the apple slices. I still remember the bag, and before you knew it, the bag, you put a little hole in it because you're moving everything around. Those apples were brown in 2 days, and you told mom you couldn't eat them, and you still ate all the candy. There's really not a good alternative. There's all the same thing from before, nutritional. There's all this thing. People are trying to push it on me, the cauliflower type of treats and things like that. To me, there is no true, substitute. It's Halloween. It's one day. Are they gonna go crazy for one day? No, but what I would do, like my kids, they would count to see how many pieces of candy. We live in an area that, they're giving out full candy bars and stuff like that. I would say, look, take a small percentage and get the rest away, or throw the rest away. No trick-or-treating this year. No, there's like trick and trunk, like in the trunks of the car. There's things there going on. But to give up Halloween, the fun thing was I was able to carve pumpkins with my kids last night. We've done it for many years, and it's the fun. Is one day going to make a difference? No. Go have fun, enjoy the day. It's on a Saturday. Make it an alternative for the kids. The kids shouldn't be cheated from Halloween. Create some type of alternative, some fun. We'll talk about nutritional stuff, what they can do later. But overall, it's the fun of Halloween, and let them dress up and have fun. Do I dress up? Typically not. Now that my kids are older, my youngest is saying, "Nah, I think I'm too good, too cool for it." So he's thinking about skipping it. But I think at the end of the day, he's still got to go trick or treating on Saturday. So overall, it's the same message. It's fun. Our energy, the sun's out, everything's great. Overall, our philosophy is, again, be proactive, take accountability. Our world today is, I hate to say it, but nobody's wants to be accountable anymore. If you're the person who's creating an excuse, then you should look in the mirror and say, are you the issue? Do it. If things are injured, or if you're injured for more than 2 weeks, you need to come in, be proactive, do something about it. There's nobody who's going to make it better for you on your own. You know, either see your primary care doctor, be proactive. You can Google anything. You can call us. We're available anyway right now with the telemedicine. We can give advice. I just had a friend that called from Boston and flies back and forth between Detroit and Boston. Just wanted to check in, but then she tells me the injury was originally 2 years ago. I'm like, you know, why today? Why are you calling in today? So again, aggressive philosophy. Think about our philosophy is that you need to be ready to play by Sunday. Same thing with your activity. You want to be able to play with your kids, you know, run around with the leaves, rake the leaves, jump in the pile. Enjoy your life. You need to enjoy your life. If there's things hindering you, find the right person, find the right tools to make it better. I mean, that's the biggest motivational thing I can say. What we're talking about, you know, too, for the summary, we're non-surgical, we're non-narcotic. We're looking to expand to another area. One of my fellows is now in Dayton, Ohio. He's looking for us to come down there and create a more non-surgical, non-narcotic, because they're running into a big narcotic thing. That's really our message. Do we use narcotics? Yes. We use it as a tool to treat. It's not our only tool. It's a very small tool that we get away from as soon as possible. Down in this area in Dayton, Ohio, it's the primary thing. So they're looking for it. But you have to be open-minded to it. If you're the patient who's looking for the narcotics and pain meds and you don't understand my pain, if you find yourself saying that, you need to look in the mirror that, you know, maybe we do understand it. And maybe you're part of the issue that you're not wanting to get, you know, to work harder. It's a hard thing to do. As far as overall, stay safe, stay healthy. Don't forget to have some fun, de-stress. You know, the biggest thing is I talked to one of my good friends. He's like, I'm stressed. I'm like, dude, your life can't be any better. You know, you got a few things going on, and it is. You know, you're not being diagnosed with cancer. You're not dying. You don't have a loved one who's in a hospital bed. You know, if you do, you know, prayers are for you. But for the most of us, don't make excuses. Stop making excuses. Find yourself, get a big mirror and look at it for a while and say, where can I improve? Where can I be the one that's the leader? And be the leader, be an example. I try to be, and I blew my hip out, but that's besides the point. So overall, you know, the message is, the quote of the day, there is no elevator to success. You have to take the stairs. There's no shortcuts. There's no shortcuts anywhere. You need to be proactive. You know, find the people. We're here to help. You know, all the doctors are here to help. There's good doctors everywhere. Find them. Find ones that want to take the time to help you. But you have to be receptive to it. Don't think we're going to do it for you. We can educate you. Okay, so enjoy Saturday. Enjoy the candy. My favorite are the almond joys. So if anybody wants to send me some extra almond joys, you can do that. But I can only have 3 a day. All right. Have a great weekend. Peace out. Love you. Paigey, talk to you soon.
All right.